Good afternoon, everyone. This is Eric here. Going to go over something new to the ambulances. We're adding this peer support warm line instructions to our rack card to our list of resources and cheat sheets we have here on the ambulance. And this is something we've worked on with the Worcester County Health Department. And we know COVID has made us change a lot of things we're doing, and Safe Stations was one of them. And I'm sure you all know by now that the Safe Stations, when a patient would come to headquarters, the peer support team was no longer coming in person. So what we're doing now is nothing different, but if you actually go to a house and you are a residence condo, if on a 911 call, and after your assessment you realize this is probably like a Safe Station kind of call, you can actually turn it into a Safe Station call and mark it as a public service call and do the same things you would do if they came into headquarters. The caveat is you have to make sure they do not require hospital treatment and transport, and make sure that they really do want help with substance abuse. So these are for those cases that, albeit that might be rare, we don't want to miss these patients, and make sure we link them to the resources, because obviously sometimes if they need help with drugs and alcohol, sometimes the ER is just not their best place. So they have the instructions on the back here, and what you're going to do is the same as you would at headquarters. You're going to sit down with the person after you evaluated that they're not in harm to themselves or others. So CRT doesn't need contacted, they don't need a psych eval, they just need help with substance abuse. You can initiate these procedures, and what you would do is call the peer support line yourself, or you could have them call peer support, and they might need that extra encouragement. So you might want to call from your phone, introduce yourself to the peer support member, and then hand the phone over to them. And it's up to you. You can either leave at that point, or you can stay with them. And again, use your judgment. You guys know this very well. You know, some patients need that extra emotional support. So this is just some guidance on how to do it. And when you leave, also make sure they have the peer support number themselves, which is listed right here. So hopefully this will be helpful, because I know there's been some calls where some people have called me and said, oh, it kind of sounded like a Safe Station, I didn't know what to do. So hopefully when talking with Health Department, this might kind of better target those people and give them the resources they need. You know, sometimes ER is just not the best place for them. So use your best judgment, and hopefully this helps and answers some of your questions. And please call me at any time if you have any questions, even if you're on the scene and you have any questions about Safe Stations and substance abuse, give me a call. All right, see you later.